Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung part. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganun. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera, siguro mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo, kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. At Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARs 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, SimplyNature.
Father ko muna, start ng take ng PPARs vial para po sa prostate cancer niya. Kasi medyo malala na Stage 4 na siya. Then, nabasag pa yung spinal cord niya. So, lumpo siya, hindi na makalakad, bedridden. Then, before PPARs po, ang putla na niya medyo nakakatakot na. So, while taking PPARs, little by little, yung pamumutla niya nagre-reverse. Namumula na yung pisngi. Nakatulong din sa appetite niya. Then, syempre, sa bowel movement. Kasi mukhang isa yun sa na-paralyze other than his legs. Sa lab test din, pati yung mga red blood cells niya nag-improve na. And yung mga SGPT, yung mga cholesterol, nag-improve din. Then sa energy levels din, kahit na bedridden siya, makulit. Since maganda yung effects, mother ko rin pinag-take ko. Kasi siya naman hypertension, na vertigo rin siya dahil sa hypertension niya eh. So sa kanya, soft gels lang. Yun, ganun din, maganda rin. Nag-i-improve din alongside ng maintenance niya yun, yung PPARS products. Then all in all, maganda naman. So, syempre, since nagandahan kami, di ako rin. Nakabawas sa stress, nakakasarap ng tulog, mataas din energy. So, ganda. Ganda eh. So, super recommended eh. Ganda nga eh. Kahit headache lang o paghihilo na babawasan, super recommended.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya. By accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So hindi niya na nararamdaman na minatapakan pala siya. So probably yun siguro yung nangyari. Minatapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So nagkaroon siya ng lagnat on and off, nakahiga lang siya. So sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So pina-check namin as OPD, chinek, binigyan, niresetahan ng gamot, tapos tinignan yung sugat, binusbos. Pero kapiranggot lang ang tiningnan. Tapos in-advisean na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka pamamaga niya, lumaki lalo. So sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So yun ginawa namin, twice a day kami naglilinis, tulungan kami ng husband niya, hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi, dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARs, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So sa PPARs, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung mo ako binayaran eh. So it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? Dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARs.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titignan mo naman yung long-term na gamutan, mas mahal yun. Tsaka hospitalization. At yung, syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of SimplyNature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti, nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of SimplyNature, PPARs. And I trust SimplyNature.
We're always with you from start to finish.
Good day, everyone, and welcome to another episode of Simply Nature Answers. We're thrilled to have you with us today for this exciting wellness series where we'll provide worthy insights and answers to the pressing health-related questions. We are an international distributor of food supplements derived from a unique strain of microalgae known as PPARs, which has been tried, tested, and certified proven to support not only cancer treatment, but also enhance general health and reverse metabolic syndromes like hypertension, diabetes, and high cholesterol. So, if you've been curious about how Simply Nature PPARS products can make a difference in your health journeys, you're in the right place. I'm Sheila, and I'm your host for this afternoon. We're really excited because today's topic is entitled The Rise of CKD in Asia. Chronic kidney disease, or CKD, is quietly becoming one of Asia's most urgent health challenges. In recent years, the region has seen a sharp rise of CKD cases, largely driven by increasing rates of diabetes, hypertension, and unhealthy lifestyles. According to global health estimates, over 60% of world CKD patients now live in Asia. This silent epidemic often goes undiagnosed until it reaches an advanced stage, making early awareness and prevention more critical than ever. Now, let me tell you that throughout this webinar, please feel free to send in your questions by dropping it on the comment section. We'll be answering as many as we can during the AMA or Ask Me Anything portion at the end. So don't hesitate to engage with us. I'd like to introduce our health experts. He is an international speaker and successful entrepreneur, seasoned international speaker on a wide range of topics from personal success to healthcare. He is the CEO and founding director of Simply Nature International and a passionate advocate of integrative health solutions. Let's all welcome Mr. Shyan Lim. Let's all watch this.
Today we're going to talk about a very important topic, CKD, chronic kidney disease. In fact, I just came back from Singapore. I'm back here in the Philippines, so it's nice to be back in Philippines. And when I was in Singapore, there was a general feel in the air, right? And what I mean is that your normal conversations with your family members, the news clips that appear at 7 p.m. news, there is this growing concern. There is rising cases of chronic kidney disease. And in terms of the education part from the government, Ministry of Health, both in Singapore and also in Philippines, there is awareness being brought to this concern. And we are noticing something. There is a growing level of questions and a number of patients who are developing CKD. So this is something that is happening, right? And I think this episode, let's focus on this, and I'm sure it will help you and your family. Okay, so what is CKD? At the very basic level, you're going to feel tired if your kidneys are not functioning well. Or you're feeling drained, you're feeling fatigued, and even after you rest, your energy doesn't seem to come back. So if you don't have CKD, but you have these symptoms, you should be concerned. I'm speaking from personal experience right now. Due to work stress, not health stress, but work stress, I have high blood pressure. So I'm going to blame my entire team, my company team, right? For the last 2 years, my blood pressure has been on the slightly high side, even though physically, nutritionally, I take Simply Nature PPARs and everything, but my emotional and mental stress is there. So having had slight hypertension for the last 1.5 years, I was actually concerned. I actually went to take a GFA test, right? I wanted to check on my kidney health. So that's a big warning flag to everyone, all right? If you're always feeling tired and drained, do check on your kidneys. When your kidneys are not doing what they're supposed to do, toxins build up. Your metabolism slows down. And that is why you're feeling fatigued. And even when you rest, you don't get the energy back. Now, why was I so concerned about fatigue? Why didn't I just brush it off to say it's Sheila's fault? She's stressing me at work. Why did I want to spend money, take effort, go down and do a GFA test? Why did I have to pee into a cup? Why all that trouble? Here's the reason why. Everyone, please pay attention. There is no U-turn in CKD. When your kidney cells are destroyed, they are destroyed forever. There is no regeneration of your kidney cells. You know, if you cut off half your liver in less than a year, it will grow back completely, almost like a lizard's tail. All right, it will grow back. If you cut your hand and you bleed and there's a wound, guess what? There's going to be some scarring, but your wound will close, it will heal. But that is not the case for chronic kidney disease. If your kidney is damaged or destroyed, it is gone forever. It will not come back, right? So you cannot undo the damage that has been done, that's done. So when it comes to CKD, our approach is we attempt to support what's left. Here's the good news. Because your kidneys cannot be U-turned, God gave you two. Okay, God gave you two. Do you realize that you can donate one kidney to a loved one, so a human being can actually survive for their life, all right, on one kidney? Right? So why did God give us two? Because there is no U-turn, so there is a spare. Okay, because if you destroy your kidney, you can't fix it. All right, what you can only do is to slow it down. Now you know why this is so important, why I went for a GFA test. Just to let everybody know, since I take a lot of SimplyNature PPARs, the good news is after I did the test, my kidneys are totally healthy. All right, the GFA numbers are in the pink, in fact, in the good range. Let me share 3 areas where many people with CKD have seen improvements. These come from our patients and our clients here at SimplyNature, and patients from Dr. Johnson Kalalan, who is our regular specialist here on our program. In fact, Dr. Johnson is very confident to be able to slow down the progression of chronic kidney diseases. He has actually successfully delayed patients who had to go on dialysis. He was able to delay it by a year or more. Now, why is this important again? If your kidneys fail and you go on dialysis, you just Google this, life expectancy of a dialysis patient. It's shocking. If you go on dialysis, your life expectancy is actually cut down to 5 years. Wow. I always thought growing up that if your kidneys fail, it just meant you had to be on dialysis for life. You will live out your normal life, but you have to go on dialysis a few times a week. Very inconvenient, very expensive, but you still get to live your life. That is my misunderstanding. Statistically speaking, once a patient goes on dialysis, their life expectancy is about 5 years. There are patients who will live much longer, but the life expectancy statistically actually drops down to 5 years. So if that doesn't scare you, I don't know what will. All right, so if I've got your attention, let's take a look. What can we do to slow down? And in the very early stages of CKD, you can actually, we said that you can't reverse kidney damage that is complete, but you can reverse kidney damage that is not complete. That means the kidney cells are not destroyed yet, they're damaged. But once they're destroyed, you don't have new ones and you cannot make new ones, all right? Okay, let's start with this one. Restore daily energy with the right nutrients, all right? So fatigue is one of the first and most constant symptom of kidney issues. Why? Because your cells are struggling to process the waste, handling nutrients, and keep your system balanced. One simple way to support this is don't eat nonsense. You don't put in trash, your body doesn't have to remove the trash. You don't have to stress the systems that remove the trash. So one simple way to support this is by giving your body nutrients that are easy to absorb and don't stress the kidney, which is why people choose food-grade plant compounds like microalgae. These natural ingredients are rich in cell-activating compounds that gently help manage energy better. So basically, if you are taking the right foods, you will feel energetic and you have less reason to take junk food. So you put less in your mouth, in your tummy, less stress on your kidneys, which has to process the waste from this entire process, all right? Number 2, and this is something so common you see in all our programs, it's almost like every episode I have to talk about this. help the body manage inflammation. Kidney issues and inflammation go hand in hand. You know, when you have inflammation, it like spillovers to, you have all these additional toxins, waste materials in your blood. It has to get carried out through the water, which has to be filtered with your kidneys, right? So high inflammation puts stress on your kidneys. So again, your kidney is like the water filter in your home. Except that one thing, here's the important idea again. Imagine your water filter and you can never change the filter. Most of us know after 6 months, the white filter in our water filter machine becomes like yellow color. Can you imagine you cannot ever change the filter? That is a kidney. You can't change the filter. If it's overused and destroyed, it is gone for good, right? So what you want to do is manage, it's not to put dirty water into your water system and straight away clog up your filter. Imagine when you buy a new water filter, that canister, imagine this is supposed to last you all your life. What will you do? Most of us will put another filter before this filter, right? Just to lessen the workload and make sure that you don't use this filter too much. Well, that is the case of your kidney. Your kidney is supposed to last you all your life and it cannot be replaced. So what you want to do is don't stress it on a daily basis, right? So we talked about having the right nutrition so that you don't have to put wrong nutrition in that needs to get filtered. Next, we talk about inflammation, right? So anything that lowers inflammation is going to be healthy for your kidneys. One thing, the good news, let's add some good news. The water filter that you use at home, when it becomes yellow and brown, you've got to replace it. But we just said that you can't replace the filters in your kidney. But here's the good news. Your kidney is self-cleaning. Your kidney is self-cleaning. Just don't damage it to the point where it gets destroyed. If you manage the level of inflammation, right, you reduce the inflammation in your body, you reduce the junk and nonsense that you're eating, guess what? The kidneys can clean themselves, right? So they can maintain themselves. So as long as you don't tear the filter, you don't destroy the filter, it is to a certain extent self-cleaning. So these steps that you can take can delay the onset of CKD. So even if today you're diagnosed with CKD, you can stop it from progressing or slow it down so that you have more healthy years. Our third tip for CKD and managing CKD is talk to your doctor, right? Your medications, regular checkup, and lab monitoring are essential. Again, why? Because there is no U-turn. Okay, so during the Ask Me Anything segment later, you can ask your questions. If those of you who have symptoms of potential kidney damage, please feel free to ask so that you can have peace of mind after this program tonight. And I just want to end with a testimony, okay? Because we were prepping up for our discussions with the nephrologists at the dialysis centers, I was back in Taiwan earlier this year and I was just making some inquiries on CKD patients. So I was very encouraged that there are patients in Taiwan that are on dialysis. Remember, I said the moment you get on dialysis, your life expectancy can drop to 5 years. Well, this patient has been on dialysis for more than 20 over years, right? I think he's now in his late 50s. So he went on dialysis in his 30s. And he's still having a normal diet. So it's not like a restricted dialysis patient diet. He has a normal diet, not extravagant, all right, but a normal healthy diet, fully active person, and he's been on dialysis for 20 plus years. How was he able to achieve that? He was on SimplyNature PPAR tablets these last 20 over years. So that's a clear indication of how our protocols can help you delay and manage your CKD so that you can have a full life. All right, so I can see all the questions coming in. I hope I didn't scare you too much. Maybe that's why there are so many questions coming in. Let's move to our AMA segment right now.
Wow. Well, good afternoon once again. We are now in what we call AMA or Ask Me Anything portion. I'm sure that you have learned so much in that discussion from Sir Shyan Lim and got you more curious about Simply Nature PPARs. So let's not keep you waiting. To answer your questions, let me call on our experts. First off, I'd like to call on our resident pharmacist here in Simply Nature, one of our caring client service officers. You all know her, Miss Jenile Macanjola. And of course, the CEO and founding director of Simply Nature International, Mr. Shyan Lim. Good afternoon, Miss Jen, and good afternoon, Sir Shyan.
Good afternoon, Sheila. Good afternoon, Jen.
Alright.
Before we begin, I just want to say, someone asked if they can ask a non-CKD related question. The answer is yes, it's a ask me anything question. All right, so let's start, Sheila.
All right. Okay. So first off, this question was thrown to us privately by one of our viewers today. All right. Is it possible for dialysis frequency to be lessened with Simply Nature PPARs?
Yes, actually, it's possible. All right. So, to help you understand how that would work so that it will make sense to you. Okay, when you take Simply Nature PIPA, the product for CKD patients that we will recommend is actually soft gel capsules. All right. Why? Soft gel capsules have the macronutrients taken out. So the carbohydrates, proteins, these are all taken out, which is good because as a dialysis patient, right? I know you want to enjoy your food. So you want to be able to take protein through food instead of supplements, right? If that's possible, all right? Now, what happens is that our PPAR extracts help to improve the efficiency of your metabolic processes. It also helps with many of the body's function, including the kidneys, the liver, all right? It helps solve inflammation. It helps reduce inflammation. So how does that got to do with dialysis? Your kidneys dialysis is to filter out toxins from your system. So if you have less inflammation, you have less toxins to process. Okay, if your metabolic processes are more efficient. So imagine instead of using charcoal, right? Charcoal to cook your food, meron lots of soot and everything in your house. You use gas stove, which is very clean, right? So your house, you don't need an air filter to clean the air in your house so much because you are not creating a lot of smoke that dirties your curtains and so on and so forth. So if you are using a gas stove, the gas burns cleanly, right? So you don't create ash or smoke. So you don't have to clean your curtains so often. So imagine the curtains in your house are like the filters in your kidney, right? So now when you use a machine, when you use dialysis, you're using an artificial filter. So you sort of don't have to worry about the maintaining the filters because that's the dialysis center that does it. But what's important is because there's less smoke and dust in your house, you don't need to clean the curtains as often, right? So that means you don't have to go to the dialysis center as often. So yes, now how much does it improve? It really depends on patient to patient. I cannot say that it will reduce from your 3 visits to 2 visits because some people makulit, just because you feel better, you eat more stuff, right? You eat more stuff, you cook more often, you dirty your curtains faster. So it really varies from patient to patient. But can it help and can it improve? The answer is definitely yes. Another very important thing is that for CKD patients, once you go on dialysis, your life expectancy actually drops very significantly. On average, if you just Google average life expectancy of a dialysis patient, it's something like 5 years. Okay, it doesn't mean that if you're on dialysis you will only live 5 years, but I'm just saying that statistically has shown that many dialysis patients have their life expectancy is about 5 years. But the good news is we have patients and clients of Simply Nature PPARs that have lived entire full lives. All right, they have lived like 20, 30 years on dialysis. Now, so some of you may ask, Sashan, are you trying to pull our leg? Simply Nature is not 30 years old, so how can you have a patient who used our product for 30 years? The answer is Simply Nature has been distributing PPAR's product outside of Taiwan for more than 15 years, almost 16, 17 years. All right. Oh, sorry, about 15 years. However, the product has been in Taiwan for more than 40 years. So we really do have patients who are dialysis for 20, 30 years and they're still eating healthy and living. That means eating a normal life, living, enjoying their life, and they're doing well. So this is where our confidence comes from. We actually have patients who are doing well. Okay?
Not only CKD, but cancer patients as well.
Yes.
Would you like to add anything, Ms. Jen?
Yeah, Miss Jen, why don't you share with us from a pharmacist point of view in when you all study pharmacology, what do you all touch on the topic of like CKD and what you can do? What are some of the common approaches that a pharmacist knows about dealing with chronic kidney disease and even specifically dialysis patients?
Okay. Actually, back when I was still a dispensing pharmacist, most of the medications are that I served are for hypertension and diabetes. As you said in the discussion video, it's the two of the biggest root causes of CKD. So what I've come to realize is that they've been buying it for years, and we cannot medicate our way out of these lifestyle diseases. We have to go deeper. We have to address the root causes and not just the symptoms.
Right. So here's the good news. So you actually now have a protocol, SimplyNature PPARs, that can help you address the root cause. Of course, for best results, right, you still need to do some modifications to your lifestyle and live healthily. In fact, most people are trying to live a healthier lifestyle today than in the past. So there's good news for everyone.
Thank you. Thank you, Sir Sean. Thank you, Ms. Jen. All right. I have a question here coming from our viewer, Veronica. All right, the question is, my husband was diagnosed abdominal aortic aneurysm, atherosclerotic disease, enlargement prostate, and bilateral thyroid lobe nodules. Oh my. What is the recommended PPAR supplement for him to take? It's quite multiple.
Wow. Okay. Da, 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 da. Okay. Because of your diseases, right, and there are multiple, okay, I would really suggest the PEPA powder extract and the PEPA tablets. Okay. So why these two, and why not soft gel, for example? Okay, since you have nodules, all right, you have multiple issues, okay? Honestly, the best would be to do SimplyNature PEPA liquid extract, okay? But why did I not recommend the liquid extract above the powder? Because you don't have, it's not like cancer where we are so afraid that the moment you move from stage 2 to stage 3, your survival rate drops from 90% down to 60%. And then if it goes to stage 4, it drops again. Okay, so for any disease that time is of an essence, like you don't even want to wait one extra day, right? That cost is not the issue, time is the issue. Then liquid is always our best protocol, our best product. However, I'm going for something more sustained. That means the powder extract it's almost the same. It's the same price as the liquid, but it lasts 3 to 4 times longer. And since you have multiple illnesses, the body will prioritize what it wants to heal first. So it doesn't mean if you take liquid, it will probably help one of the most serious of the diseases you've listed. All right, it will focus more of the healing power on one. It's not saying that you only do one, then the next, then the next. Everything's being healed at a time, but the more serious one that the body will do its own prioritization. The body will choose which one to focus a bit more on, right? And because of that, since you have so multiple illnesses, it might take some time. It might take some time. So being able to stay on the product longer, unless your budget, if you have no limit for your budget, to go for the liquid, okay? That's the best. That's really the best. But if you want to be more economical, the powder extract will be a good start because it'll last you almost a month. So over a period of a month, you can allow your body to be able to deal with multiple diseases, improving all of them, giving sufficient time to improve all of them, okay? So we always take the powder extract, okay, with the tablets because the extract is like the essence. The tablets is the fuel. It provides all the necessary vitamins and minerals and other nutrients to power. It's like the battery power is the tablets, okay? The extract is like the special essence that you use to activate your body, okay? So you combine these two. Now, after 1 month of the powder extract, we can look at if finance is an issue, right? And in our program, we just want to be upfront. If finance is ever an issue, it doesn't mean you cannot avail healing. It just means that you have to take slightly longer time and you have to be more disciplined in your lifestyle change, right? The more you eat correctly, live correctly, then you have to use a less powerful version of the protocol and you will be able to go on your healing. Okay, so after 1 month, you can consider to go down to the soft gel capsules. Okay, the soft gel capsule. So there you go.
Thank you. It's quite multiple. Miss Jem, would you like to add anything?
Yeah, all of what Sir Shan said is good, but I would just like to add Cleansing Plus also for detoxification. All these multiple health issues, you must be already taking lots of maintenance medicines also. So Cleansing Plus will really help to detox out all those toxic residues out of your synthetic medicines.
Jen, that's a very good point, because it really is the pharmacist that will take note that the patient was probably on multiple medication. Yes, and of course, an enlarged prostate. So if you have constipation or your bowels are hard, I think it's gonna make the entire process painful also. So since you have an enlarged prostate, the cleansing plus will help to soften your stool and I guess make it less painful. Because I don't have a enlarged prostate before, so I can only medically what we learn, yes, doesn't mean we experience firsthand because I don't have this illness firsthand. So I can imagine it'll make the entire experience easier for your husband. Yeah, correct.
Thank you. Thank you, sir. Thank you, Ma'am Jen. Okay. Another question. Okay, thrown to us again privately by one of our viewers. Does PPAR's tablet have binders? I take them for prevention, and I noticed that sometimes it's easy to chew, but sometimes it feels different.
Okay, very good question. The answer is no. And proof is what you just said. Okay. Sometimes it's easier to chew, sometimes it's not easy to chew. Okay, so what does that mean? If we use binders, it will always be the same. Okay. The reason why sometimes it's easier to chew and sometimes it's not easy to chew is because we don't use binders. So let me explain why. Because the way we make the tablets is how you make povorone. Is it called povorone?
Correct.
Right?
Povorone,
You know how you make
yes.
povorone, right? You take the powder and then you press together and then you let go, it stays in the shape. Okay. Now, there's only one ingredient in our PPAS tablet, only one. It's just our unique microalgae. That's all. So we don't use binders. So we use pressure to push the microalgae powder into a tablet. Okay. So in the manufacturing process, right, because our products are natural, right? So different seasons, the microalgae powder might be a little bit, the consistency or the texture might be different. So what the factory does is every time when they make the tablets, they will adjust the pressure a little bit more. Okay, so sometimes they press the tablets harder. Other times they use a bit less pressure. So that's why when you bite into it, sometimes it's harder to bite because for this batch, they use more pressure. Okay, why? Because maybe when they again, the product is natural. So when they take a look at this batch of the microalgae powder, the consistency might be a bit different from the other batches. So they adjust the pressure to know how hard you need to press. I guess I've never made povorone before, but I guess maybe if on a hot, humid day, you probably use less pressure because the atmosphere has more moisture, right? So it'll stick easier. So you don't have to press that hard. So because our product is naturally produced, so I think this explanation will help you understand. Now, how do you know we don't have binders? Okay, you can just take one pipa tablet, you put it on the table, and you take a 10 peso, 5 peso, 1 peso coin, and then you just press it. Okay, sometimes it's harder to press because again, how hard did we pressurize the tablet? Or sometimes it's easier. But the moment you break it, you will notice the tablet breaks into very fine powder, so fine that if you see, you cannot see anything. That is to prove to you it's like povorone, right? What happens when you press the povorone? Boom, it just crumbles, right? So the same with our Simply Nature BPA tablet. So yes, no, we have no binders at all.
Excellent. All right. Would you like to add anything, Ma'am Jen? Okay.
Yeah, aside from no binders, we also don't use any other kind of preservative, sweetener, or flavoring. And we
Yeah,
can
there's
feel
no
this.
flavoring. That's why it tastes like mango.
Yeah.
Yeah.
Yeah. But beware, we've also had patients with different health issues, and because of that, they also have different taste.
Yeah, that's a very interesting and very important point, especially for example, if you're taking medication, undergoing chemotherapy, things like that, it will change your taste buds because of your medication. So sometimes, I'm not sure, Sheila or Jen, if your clients say, hey, Sheila, how come this batch of pipa tablet tastes different from the last batch? Okay, it's because number one, because of your medical condition, it does change your taste buds. So those of you who also notice, this also happens even when you go on a diet. If you, for example, if you don't eat meat for 1 month, you will notice your taste buds will change. All right. That means suddenly vegetables taste a bit sweeter. And then the first time you eat meat, it may or may not be what you remembered. All right. So why? Because your body's health condition changes also when you change your diet. It either improves or get worse, and that affects your taste as well.
Excellent. All right. Actually, the next question that we have here is related to tablets, and it's quite interesting as well because it's coming from Miss Kim. I want to take PPARS tablets, but I am a CKD patient, and as you know, water intake is just limited to 1 liter per day. Can you suggest another way to drink it, or the 30 micro tablets? It's hard for me to swallow.
Okay. Okay. This is a special case. It might take a bit more, how shall we say, effort. If it's something that is prohibiting you, stopping you, right? Then let me suggest this. You can actually put your 20 micro tablets or 30 micro tablets into your water bottle or a cup of water. All right. After about half an hour, it will just break up. You don't have to stir or anything because I said we don't put binders, right? So when water, it's just like soaking your pot. You know, when you cook something and it sticks onto your pot, what do? You just soak it with water, right? It starts to soften and break up. You will find that the whole water bottle will become like a green suspension. The algae will be floating in the water. You can't actually taste it. It's not like you put what's that, tang, and then your whole thing. So you put 30 tablets, your water tastes like algae. No, it doesn't have that taste. Okay, the taste only comes when you bite into it, right? But you can try first. Maybe you on the first attempt, you put maybe 10 tablets into a water bottle or a cup, leave it for half an hour or something, and then you stir it, and then you drink and you see if, oh, okay, the taste doesn't affect you. That's great. So that's one way you can do it. I found out this method from my niece. My niece Meron very lazy, and she don't like the taste to chew, so she won't chew. And then she sometimes very lazy. So what she does is, she wakes up late and then she's rushing to school. So she on the way she will just drop all the tablets into her water bottle, and then throughout the day she'll just drink it. Okay, so she takes her tablets this way. So you can try it this way, and see if that is something that works for you. This way you can also measure your water intake, right? 1 liter, diba? So you can also, so yeah, so you don't have to drink extra water, and yeah, maybe you will grow to like the slight taste, and that will make your drink more pleasurable as well. So try that. The other way, of course, is that you can learn to chew it. All right, you can learn to chew it. Yeah, yeah. So just do these two methods. Or nope, actually it's these two methods. It's just these two methods. All right, thank you.
Miss Jen, would you like to add anything?
Yeah, what Sershan said isn't actually strange because that's how we recommend to mothers how to take the
Oh.
PPARS tablets to their toddlers.
Okay, so Jen and Sheila deal with the patients directly, so I think they got more hacks than me.
Actually, I just also want to add, because we also have patients who are on NGT, or nasogastric tube, or feeding tube. So for them, we actually advise they can crush the tablets and just mix it with the smoothies that they give to the patients as well. So that's one way as well. All right. So for our next question, okay, it's coming from our viewer, and relate tablet related as well. So what's the difference between the PPARS tablet and the PPARS Plus tablet?
Okay, before I answer this question, I just want to say that Miss Veronica, I see your follow-up question. I'll answer it after this. Okay, what's the difference between the PPAS tablet and the PPAS Plus tablet? Okay, the PPAS tablet is the original product that we developed. Okay, so as we did, the National Health Research Institute of Taiwan, the leading researcher, Dr. Sui Zhen. All right. He's also the person who hunted SARS. You remember the pandemic SARS? Okay, it didn't create a lockdown, but it was still a pandemic. So he was the one who hunted down SARS, and he was the one who did our research, right? So he did recommend that we take a look at this thing called resveratrol, right? He said that the mechanism for resveratrol would be synergistical. That means it will benefit. It works differently from PPARs, but together it will work well. Okay, so what we did was that we didn't do resveratrol. We did something better than resveratrol. So we took red grape skin. Why? Because near our farm, the area where we grow the microalgae is also the area where they have vineyards, where they make Taiwanese wine, red wine. So there were a lot of vineyards available with fresh, good skin, because after they make the wine, left over the skin of the grapes, diba? But this is where all the polyphenols, including resveratrol, is found. So we use the same method to extract, okay, how we take out the SimplyNature Pipa liquid extract, powder extract, right? We put the grape skin through the same process, and we found that we were able to extract very high quality grape skin polyphenols. Okay, so resveratrol is only one of the polyphenols found in red grape skin. So we took all of them, all right? So like I said, our product is more natural. We try not to remove too many things because we don't know how the natural polyphenols will work together in our body. So we try not to remove, we try and keep as many as possible. Yeah, so that's what it is. So when you compare PPAS tablet and PPAS Plus, the Plus contains resveratrol. Technically speaking, right? The PPA Plus should be better. Okay, it has one additional ingredient that works well with our PPA mechanism. Okay. Then in that case, your question is, oh, then I should always take PPA Plus and never PPA tablets. All right. Okay. There's one reason why in my house, there are still PPA tablets and not PPA Plus tablets only. Dogs cannot eat grape skin extracts. So my dogs in my house eat PPA tablets every day, all right? So they don't eat the PPA Plus tablets because dogs should not be eating anything with grape skin in it, and they're actually sensitive to resveratrol. All right, so there might be patients out there who have certain conditions that are sensitive to, for example, resveratrol. So you will notice that there are resveratrol supplements out there in the marketplace, and there's always a warning label also for those who are allergic or sensitive to resveratrol. So for example, people who cannot eat grapes, right? They are allergic to grapes. Then the content of grape polyphenols may not be ideal for them. Okay, so that's the main difference. Yes, in a way, I would say that the Plus is improved because we added something in addition to the normal tablets. Okay, so it's an improved version. But why do we still have the PPAS tablets? Because that is actually sufficient. All right, and it is one less ingredient. So in case you don't know what you are sensitive to, So don't forget, we also have patients who are patients who have allergies that take our product. For example, psoriasis, eczema. So the less ingredient we have inside for those patients, the better it is because we don't know what triggers them. Diba? So having the tablets will be ideal for those who have sensitive systems. The less ingredients you have, the less risk that you are taking something that will give you an allergic reaction, right? So that's how I would differentiate. But if you're healthy and normal, then I would say the plus is the fortified version of the tablet. So yeah, in a way, it is the better version of the tablet. Now, for cancer patients in general, we would say that the plus would be ideal because it really complements the PIPA tablets.
Great. Miss Jan, would you like to add anything?
Yeah, Miss Jen, are there any people who are allergic to resveratrol? Because I know for dogs they are, because I actually search. Okay, so that means that if dogs can be allergic to resveratrol, I'm sure humans may have the same kind of condition and be allergic to resveratrol as well.
Actually, I have a personal client.
Oh,
Yeah. The patient is a kid with a cancer, but unfortunately also has G6PD.
okay.
So the doctor isn't allowing grapes for them. That's why they only buy
So
PPARS
there we
tablets,
go.
not PPARS Plus.
T6PD. All right, all right. Okay. Yeah, so for cancer patients, you see, not every cancer patient can take plus. So this is why we have both the normal tablets and the plus. Oh, thank you. I learned something today, Ms. Jen. I learned something new. Okay.
Thank you, Miss Jen. Thank you, Sir Sean. All right. I guess this will be our last question for today. Okay. It's the follow-up question of Miss Veronica. So the question
Ah,
is, yeah, if my husband takes PPARS liquid, how many vials or what's the best dosage or how many vials then can he swift in 2 tablets? Let's say if I buy 3 boxes of PPARS liquid, he does not need to take PPARS tablet anymore.
okay.
Good
Whenever
question.
anybody takes the liquid extract, we always ask them to take the tablets. So whether you take powder extract or liquid extract, you always take the tablets. Why? Because uh the 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 powder and the liquid extract is made from the pipa, the algae that the tablet is. All right. So that means we take out only the pipa agonist and the important phytonutrients, all right, that makes the pipa so special. But because we extract, we left behind other ingredients as well. Sorry, other nutrients as well. So when you want to take the original whole thing, but for healing, it is for healing and treating the root cause of your illness. It's really the PIPA extracts that work. But it doesn't mean that the body doesn't need the rest of the good things found in our unique microalgae. So that's why we always pair up so that you get the complete thing. So for example, some patients take maybe our product with a multivitamin. Maybe you take the powder extract with a multivitamin. Then I will say, instead of taking the multivitamin, please take the tablets instead, because the tablets are made where the extracts come from. So they complement each other more perfectly. And the tablets are multivitamins. It has the full amino acid profile. It has vitamin D. It has vitamin E. D is you go in the sun. Okay. Vitamin C and all that. So it has all the nutrients already. So that's why you always take it together. Now the next thing is, if you buy 3 boxes of liquid PPARs, does this mean that your husband's condition is that enough? Okay, the answer is we can't tell, because this is a program where it's not a consultation, right? Next, so I don't know your condition exactly, right? Like at what stage each disease is. And next is because the product doesn't work on the disease, it works on the root cause of the disease, right? Here I give you an example. Okay. How many spray of perfume to cover the smell of sausage, okay, on your clothes? The answer is one. One, right? Because you didn't get rid of the oil stain from the sausage. But I ask you, but if you really want to get rid of the smell of the sausage, permanently, guess what? You have to wash your clothes. Diba? So how many times must you scrub your shirt before the sausage oil stain comes out? It depends what kind of sausage you were eating, whether it was a longanisa and whether it's a Pampanga original longanisa, which a very strong smell, or is not, or is it a processed longanisa, which is not so strong smell, right? So there are many. So I can't tell you exactly how long you need to wash your clothes before the oil stain from your longanisa comes out. But if you use a perfume, I can tell you exactly how many times you need to spray to cover the smell. One, you like that, and you can't smell the longanisa anymore. But when the perfume fades, the longanisa smell still comes back out because the stain is there. Okay, so when you take SimplyNature PPARs, it's not a perfume. If you take a drug, that's a perfume, right? The drug will work immediately, and then it will last a certain amount of time, and then you have to take the drug again. Okay, so why? Because you're not actually getting rid of the root cause, which is the longanisa stain. Okay, you are covering up or you're treating the symptom, which is the smell. Okay, so with our product, you're actually trying to wash away the longanisa stain. So how long it takes, it will depend exactly how serious the stain is, blah, 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 blah. So that's your body's unique condition is like that. So we won't know. But if you take the liquid extract for 1 month, I am very confident that your husband will experience improvement. Okay, maybe one of the issues will improve vastly, while the others will improve significantly. Now, at that point, right, after 1 month, we will want to decide. Now that your husband's condition has improved, you can choose to keep on this speed, all right, then you can keep on the liquid. But if let's say financially, oh, okay, you want to go on a smaller budget so that you can last longer, right? Because you don't know how long it will take for your husband to fully recover. I would say a benchmark would actually be a complete or recovery where you can then go on to something very, very light, like for example, the soft gel capsule and tablet combination. I think 3 months would be a good first gauge, all right? 1 month, you will see improvement, but it's not after that, you still have to take either the powder you probably have to go onto the powder extract if you don't want to stay on the liquid extract. Okay, so if you're on the powder extract, yeah, you will probably also take about 3 months. Okay, so if that's the case, if both is the same, then why should you take the liquid? Because it depends on the medical condition of your husband, right? If the case is serious, you might have to take the liquid first so that we can see the initial mirror momentum, diba? It's mirror momentum. So you need to get moving first, remove get so that what's left is the stubborn stain at the behind. You notice when you wash your clothes stains, right? To get rid of the brown color, very easy lang. But after a while, there is still meron like a shadow, diba? That that one you have to scrub and scrub and scrub to get it completely gone, right? But to get rid of the original brown stain is like very easy, yeah. But then it will fade. Then there's the light brown thing that is very stubborn, hard to get out completely. So this is why whether you use liquid or powder, the tail end, that means to really 100% fully recover. That last part is slightly depends. It may take some time, right? Whether it's 1 month, 2 months, 3 months, it's hard to tell. But however, the difference is when you use the liquid, the first 1 month, you will feel the improvement. And if you are ever a patient, you will know, doc, please help me feel as good as possible, as fast as possible, because it's a terrible feeling to be sick. So this is why the liquid will be the best if money is not an issue. But if you're talking about managing your finances, then after 1 month, the worst part, right, is okay. Again, then we use the stain again. Like if you need to wear the dress, right, but it's you're going to a party at night. If you don't get rid of the brown stain, everybody will notice, why are you wearing a dirty shirt? But if you manage to get rid of the brown stain, just leaving the shadow, maybe at night people can't see clearly, so nobody will know that your clothes has a stain. Okay, so it's the same, right? Because if you're sick, why would you use the liquid? So that you can quickly get rid of the worst part of it all. So the rest is more manageable, right? And you can take a longer time because, okay, it's okay. You feel a bit uncomfortable, but it's still okay. So then you can take your time to get rid of the root cause, all right? Again, this is because
This is to manage budget. All right. I hope I by giving you this answer, it also helps everybody else, and that yeah.
Just to echo out what you said, sir. So, tablets are still necessary, but it has to be taken alongside either the PPARS liquid extract or the powder. Depends on the budget capacity. Uh, Ms. Jan, would you like to add anything before we go to our parting words?
Okay, aside from that, please be guided closely with your assigned client service officer. So she can give you the best recommendation based on your budget and also how to properly take this either vials or powder along with your other medications.
Okay. I did notice what mom said. She said that the husband's case is asymptomatic. Okay, so my next question is, okay, it's asymptomatic, so it doesn't affect your husband's how shall we say comfort level at all. However, what we want to then I guess I will stand by my hold on, I'm looking at your conditions and I'm thinking about it. Okay, so your thyroid nodules are probably benign. If they're benign, no problem. Enlarged prostate is a benign condition. It's not cancerous, right? It's just that it affects your urinary tract. All right. Hardening of your arteries. That's what your atherosclerotic disease is. All right. And okay, and your abdominal aortic aneurysms, right? Okay, this is a risk of it being ruptured if it grows too large. Okay, so none of these are like super urgent, right? None of these are like immediately life-threatening. Then I would say that if you want to transit to the tablet as fast as possible, I think you must help me understand why would you want to transit to the tablet as fast as possible? Is it because of financial reason?
May I just add that before transitioning to a lower grade or lower form of PPARS, it would be best to have it backed up by laboratories or scans.
Yeah.
Yeah.
Yeah. Before you change any dosaging, right, you always go for a scan, right, to see how much has improved so that you can make a better decision. You don't go by timing, all right? You don't go, oh, I eat 3 months already, then I go down. No, you don't go by timing. You must go by how is the effect on your body. Then you will decide whether you go down or not. Okay. So looking again at if he's asymptomatic, then I would say if finance is an issue, then I would suggest get one liquid to kickstart everything. So the first 10 days, he really gets in the momentum. And then from then on, just do powder. Okay. So basically, if you do 3 boxes of liquid, that will last you 1 month. Okay. If you do 1 box of liquid and 2 jars of pipa extract powder, that will give you almost 3 months, 2.5 months. So there's a big difference between 1 month on a protocol and 2 months, 10 days on a product on a protocol. So there is a big difference in how long of time your body is given to heal. Okay, so then that will be my best suggestion to you. And then whether after the second month, that means in the third month, whether we need to maintain on the powder or we can go down to, for example, soft gel capsule and tablets, and then finally the tablets. That will depend on how much improvement your husband's condition has. Okay, so we can do a test. So I would suggest why not go for 1 box of liquid and one powder extract. After 1 month, 10 days, you do a diagnostics. All right. So see the improvement. Let's say there is improvement, but not there yet, then continue with the powder. And then you will know, and then you do another diagnostic, go and check up again. And then, so this is a very systematic, evidence-based, safe, secure way of getting healthy. And then your husband, like all men, maybe they don't like to take anything. They men are like lazy, trying to get your me trying to get my 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 dad to eat something is like very difficult. So giving him evidence to say, okay, take this because 1 month later we're going to test, and then when he see the results of the test, it will be easier for him to comply, and then you get your your wonderful husband healthy and back. You are a good wife, huh? Because you're actually watching this program for your
Yeah.
husband. All right, so I know kudos to you. Kudos to you, Veronica. You obviously love your husband enough that you are listening to this on his behalf. Okay.
I agree. I agree. Well, thank you so much, Sir Sean. Okay, now at this point, it looks like we've covered all our questions today. But for if you still have a lot of questions in mind, all right, you can throw them privately through direct message to our Simply Nature Pars Facebook page. We'll directly attend to them, and also we can actually ask them again by tomorrow. Okay. Now, at this point, our topic today is indeed relevant as many people are really concerned about being on dialysis or going for dialysis. Now, as we wrap up this afternoon, I'd love to hear both of your parting words. Would you like to start, Miss Jen, and then Mr. Shandip?
No, I'll start. I'll start.
Okay, all
Let
right.
Jen close, all right? Thank you. Veronica says she really enjoy and appreciate this session. So, Veronica, just to let you know, good news is if any of you have enjoyed this session, here's the good news. You'll be able to do this live. All right. We will have a live in June, and not only me. Okay. You're gonna have another integrative Dr. Johnson. He's an expert, he's a medical doctor, but he's into integrative medicine. So, and he works with Dr. Jimmy Katapia, who is a surgeon. So on the panel, you have me, which is PIPA expert. And then next, you actually have a surgeon. So in case you have any questions about surgery, right? And last but not least, you have Dr. Johnson, who's our regular doctor on our program every Thursday night on Simply Heal, right? So you have all three of us live at the same time. The most important thing is at the same time, because sometimes when you talk to a surgeon alone, he will tell you one thing. If you talk to the integrative doctor, he'll tell you another thing. But when you put them two together, they have to no choice tell you the complete picture. All right. So yes, because sometimes as patients we get confused. You go to this doctor, he say yes, must have surgery. You go to the other doctor, say not necessary, lang. I think this one's still okay. Then you're like, so who should I believe, right? But the best is when there are two on the stage at the same time. They have to give you a final answer. And this is the benefit of our SMX event coming in June. I think the first week of June. I think Jen and Sheila will probably share the details on how you can book your seat. It is going to be held in BGC, which is in Metro Manila. For those of you who are not sure, it's actually held at one of the top best SMs in Philippines, SM Aura. Okay, I think next to MOA, this is the best SM because it has all the interesting shops and it's very nice. All right, and beside that, it's actually Market. I think it's Ayala's biggest mall. So for those of you who are in the province, we do it it's on a Saturday morning. So it's early in the morning. I think it's probably like 9 a.m. or yeah, something like that. Why do we do it so early? Then those of you in the province have to start traveling at 4 a.m. or 5 a.m. Okay, why do we do it so early? We do it so early because we also know the venue is a good venue. So if you are from the province, you come early in the morning, 9 to 11:30 or 12, depending on how many questions you guys ask. All right. And then after that, you can take the opportunity to go with your family to SM Aura or Market, and spend the day with them. So if we do it later, then by the time, there's no more time to do anything, especially if you come from the province, it takes you 2-3 hours to come. You might as well walk around with your family. There's even a movie theater with the IMAX, one of the few IMAX in Metro Manila. So it's something that's why we chose the venue, because we thought about people who are traveling a bit further to get to us, then make it at least a place where you can do lots of other stuff with your family members as well. All right. So I think I should end with something about CKD, right? So CKD is a very serious thing. Guys, it's not only in the Philippines. This time when I last went back to Singapore, the disease everybody was talking about was chronic kidney disease, CKD. Last time we used to talk about dialysis, kidney failure, right? So we don't talk about CKD, we only talk about kidney failure, right? However, today Now we are talking about CKD. So CKD will lead to kidney failure, but that just means many people right now are having kidney problems. This is largely because of our diet. One of the things you should notice, and I do notice here in Philippines, it's really true, but in Singapore, it became true because we have a lot of Chinese, mainland Chinese, that means Chinese from China. So many of them came that our restaurants changed to fit their taste buds as well. So for those of you who don't know, those from mainland China, they eat very salty food, like a Filipino, also like a lot of salty foods. So having high salt content in your food does make it does hurt your kidney, right? That's and the strong processed foods with the strong taste, the very strong taste, like your spam and all these things, very strong taste. You take a canned sardines, all these are food that has a very strong taste. They stress your kidney a lot. So I think that's another reason why all of us, a lot of people are developing CKD. Very dangerous. CKD is very dangerous. Even I'm afraid, right? Because I have high blood, I have hypertension from stress. Okay, not from food. So it is still a lifestyle. It's my stress because Jen, mom Jen stresses me a lot. So that's why. So because of high pressure, hypertension, which is high blood pressure, I've been having high blood pressure. The stress has been for more than a year. So, Miss Jen, stop stressing me, huh? Okay. Yeah. So not only Miss Jen, actually all my staff stress me because I want to see all of them succeed, right? So that's why we're pushing hard. Okay, next is because of the hypertension for 1 year, I was worried that the pressure will affect the kidney, right? I actually went to do a full GFA kidney test to make sure that my kidney function did not deteriorate, did not drop, did not get damaged because of having more than 1 year of high blood pressure, right? So that's how important it is that I will go and do this check simply because I have high blood pressure. And the reason why I'm so scared or why I'm so concerned is once your kidney is damaged and if the kidney cells is destroyed, they cannot be repaired. Okay, that's why God gave you two kidney because you can't repair your kidney in a way. You cannot repair a destroyed kidney, right? It doesn't regrow. Kidneys don't regrow. You only have one liver because even if you cut half your liver, 1 year later, it will grow back. Meron like a lizard's tail. It will grow back, right? You cut your hand, it bleeds, but the wound will close. It will heal. It will grow back. New skin. You will have new skin. Your kidney cannot have new kidney cells. Okay, let's get this very clear. Your kidney cannot have new kidney cells if they are damaged. It is forever. So that's why I was scared. Even though God gave us a spare, I don't want to use my spare. I want that spare all the way to the end of my life. Okay, so today's topic, CKD, is a very important topic. If you have had high blood pressure, hypertension for more than a year, 2 years, 3 years, there is a likelihood that your kidneys might already be damaged. So go and go to High Precision and just tell them I want to do the test for kidneys. I think it costs 2,000-3,000 pesos. All right, but at least you will know that your kidneys are fine. Okay. So yeah, I think we talked about some early symptoms of CKD. Another reason is I'm 51 years old this year. So I noticed the last 1 year I've been waking up in the middle of the night to go to the CR. So that comes with old as you get older, but I also worried, is it because of CKD that I'm going to urinate more often as well? And yeah, then my urine also had bubbles. Then it turns out I'm dehydrated. I don't drink enough water. Okay, so all these little symptoms scared me a lot. So I just want to share with everybody, it is important to look into this. If your kidneys get damaged, your quality of life is going to drop like crazy. Your lifespan will drop and it will cost a lot of money as well. So it's a stress on your family, it's a stress on yourself. So do take care of your kidneys. And with that, I hand the time back over to Jen and Sheila.
Thank you, Sir Shyan. Miss Jen?
For me, I also want to highlight the upcoming Lenten season. So aside that our BGC Taguig office is closed, many of us will give up foods like meat, sweets, processed food, and unknowingly, we also allow our bodies a chance to rest and reset. So that's not just spiritual discipline, that's also physical detoxification and cellular healing. So, what if we continued this approach even after Lent, every day? What if we saw every meal, every supplement, every choice as an act of healing stewardship over our body? And with that thought, I will leave you with one of my favorite quotes. So listen carefully, yeah. The food you eat can be either the safest and most powerful form of medicine or the slowest form of poison. Thank you and see you tomorrow.
That was heartfelt. Thank you, Miss Jen. Thank you, Sir Shyan Lim, for that amazing parting words towards our viewers for today. Now, may I just say that if you or your loved one is battling any type of cancer or any health issue at all, remember, science is evolving and new treatments are emerging all the time. Keep informed and explore all available options. So don't forget to like our Facebook page, Simply Nature International, and subscribe to our YouTube channel as well. This is also to make sure that you can get updated with our latest promos and events. Once again, guys, this is what Mr. Shyan Lim was telling you about earlier. We are calling all our cancer patients, survivors, and advocates. Let us all come together to explore the latest advancements in cancer treatment and engage in the multidisciplinary experts dedicated to enhancing your well-being. This is happening this coming June 7 at SMX SM Aura, and our panel of experts is composed of a PPARS expert, lifestyle medicine doctor, integrative doctor, and surgical oncologist. So take advantage of this face-to-face AMA portion where you can ask our doctors live during the event. So please watch out for the announcement on how you can buy your tickets to this exciting event this coming June. All right, now you are in for a treat because we have an exciting lineup of promos exclusive for direct and website orders only. So, because if you buy a box of PPARS liquid extract or a jar of PPARS powder extract, you will get 7 sachets of Cleansing Plus for free. Guys, that is worth over 800 pesos of free products for you. Now, another exciting promo is that if you buy 3 individual packs of soft gel capsules, you'll get an extra free pack of PPAR soft gel capsules, which is actually worth 3,700 pesos. Wow, that is so amazing, right? Now, once again, this promo is up until April 30 only, so month end. Okay? But wait, there's more. Last but not least, and I'm sure you wouldn't want to miss, valid only through website order only. Enjoy our free shipping nationwide when you shop worth 3,700 pesos and up on your favorite Simply Nature health solutions. This amazing offer is valid only for 3 days. Okay? So that started yesterday, April 15, today, April 16, and last day tomorrow, April 17. So what are you waiting for? Visit our website at www.simplynature.asia to check out all our participating items or products. So experience the benefits of PPARS at an unbeatable price, because now is always the best time to get the best health, not only for yourself, but for your whole family. So experience the benefit of this amazing products. We hope to see you tomorrow, Thursday, that's April 17, at 7:30 p.m. on our regular Simply Healed webinar. That's correct, guys. We will still be having our webinar tomorrow night at 7:30. It is entitled Chemotherapy 101, what you need to know if you chose chemotherapy in your cancer journey. All right, so we hope to see you once again tomorrow. Know that your victories over your health battles are what keep us going here in Simply Nature. Because here in Simply Nature, we're always with you, from start to healing. Thank you, everybody. God bless you all.